Thank you. Hi, everyone. Again, my name is Katie. I'm one of the pediatric residents, and I'm happy to be here today to talk to you a bit about the role of influenza vaccination, in particular in IBD, and some of the things that we learned from a survey we did in the winter, looking at some of the barriers that families face in getting the vaccination for their child. So this is a very hot topic. This is something that everyone's talking about because we know that any patient that has a chronic medical condition or that's on medications that can suppress the immune system, so things like azathioprine or Imuran, methotrexate or Remicade, are at more risk of all of these infections that Dr. Benchimol has been talking about, as well as influenza. So they're also at risk of complications from these infections. So multiple guidelines in Canada, in the United States, and in Europe recommend annual influenza vaccination for all patients who are immunosuppressed, including those with IBD. So as a pediatric resident, we spend some of our time specifically with the Division of Gastroenterology. So I had the opportunity to be in IBD clinic over the summer and to meet some of you there. And over that time, through discussions with the care teams, we realized that we didn't know what the vaccination rates were for patients followed at CHEO with IBD, and we didn't know what some of the barriers were that families were facing. So we wanted to study that. So we gave out a survey to all parents and for any patient who is 14 years of age or older who are coming for routine clinic appointments from September to February of this past year, and asking you to participate in this survey. And the response was incredible. We actually had the chance to present this research at the Resident Research Day last month, and the audience couldn't believe the response rate that we got. So 98.8% of parents and all the patients that we approached agreed to participate. So I think that deserves a round of applause. So I think that says a lot about how dedicated this group is to research and to improving care for your children with IBD, but as well for children in the future. So that's wonderful. So if we look at the statistics of the patients with IBD in this study, it basically matches what we've seen in larger studies of patients with IBD. So mainly it's males who have Crohn's disease subtype and presenting in the early kind of pre-adolescent years. And about 3/4 of our patients are on immunosuppressive therapies, and again, that would include things like methotrexate as well as the biologic agents like Remicade. And that's, again, typical of most populations. And then patients were followed for an average of just over 3 years in the IBD clinic. So we also looked at measures of disease severity in our patients. So we can calculate a disease activity index based on what patients tell us about their symptoms at their appointments and what we find on physical examination and on blood work to figure out how active the disease is. And it's interesting that when patients first come to clinic, there's a pretty even spread of mild, moderate, and severe disease. And at the time of our survey, actually 96% of patients had either no or mild disease activity, which is great to hear, and it also gives us a lot of insight into when patients are making decisions about whether to get a vaccination. In most cases, they aren't actually experiencing many, limitations at the time of that decision, so that's important for us to know. So we found that only 34% of parents reported that their child gets annual influenza vaccination as is recommended by the Public Health Agency of Canada. And this is pretty similar to studies that have been done in adults populations with IBD. So we wanted to know, who is getting vaccinated? Are there any factors that are linked to that decision? And we found that in most households where family members are all immunized against influenza, it's more likely that the patient would be as well. And then if the patient has been followed for more time in the IBD clinic, that was also linked to being more likely to have gotten the vaccine. And that may be because then there's more opportunity to speak with your IBD physician about the risks and benefits and to get that opportunity to discuss those recommendations. Some things that weren't linked, it didn't seem to matter kind of what age the patient was or what the subtype of disease they had or what medications they were on. That didn't seem to be linked to that decision. So why are people not getting vaccinated? We offered a number of different reasons on the survey, and so we're presenting the top 3 here. So the number one reason mentioned by both parents and patients was that they didn't think the flu vaccine would offer much benefit. And this may be by virtue of having IBD or just because they didn't think it would be that helpful in general. Other things that were mentioned were a concern about side effects. No one really liked getting a needle or didn't think their child would. And a lot of teenagers felt that it was quite inconvenient for them to make another appointment to get their flu shot amidst all the other things that they were doing for care of their health. Some things that aren't posted up there, about 20% of patients were worried that the vaccination would cause their IBD to flare. And 15% of parents just didn't feel like they had enough information about the vaccine itself to make that decision. So we asked, if your IBD physician could provide you with that evidence that the flu vaccine would have a benefit and would help keep your child healthier, would you get it then? So 94% of parents said that yes, that would influence their decision. And 80% of teenagers agreed with their parents, which is pretty impressive considering that's not something they tend to do. So then we asked, well, we know that people want it to have a benefit and they want to know that it's safe, but they also want it to be convenient. So if we were able to offer that vaccination to your child in clinic, would that be motivation to get the vaccine? And again, quite consistently, the answer is yes. So 74% of parents, which includes 16% of parents who would come back to a separate appointment just to get the flu vaccine, this is how many people said that that would be a big factor for them. And a lot of patients, similar numbers, kind of agreed with that statement. So we've learned a lot from this study. We've learned that our vaccination rates are actually quite low in patients who are really at risk for influenza infection and for complications from that infection. But we've also learned that families are very open to getting vaccination. You just want to know that it's going to be beneficial and that it's going to be safe, and that there is a big interest in getting vaccination if it's actually offered in clinic. So we want to thank you so much for your participation in this survey. It's amazing for me as a learner to see a group this dedicated to this kind of research, and it's important for you to know that we're just as dedicated to use this information to address some of these barriers for the next flu season. So that'll include advocating for access to the vaccination in clinic, as well as ensuring that you have the most up-to-date information on the benefits of flu vaccination in IBD. So we're going to start some of that tonight, and I'm going to tag Dr. Benchimol back in to talk about some of the latest evidence for the safety of flu vaccination in IBD. So thank you.
So we're going to talk about this journal article that just came out about 2-3 weeks ago in the journal Pediatrics, looking at the safety and uptake of the flu vaccine in Ontario children with IBD. This is an article that came out of the Institute for Clinical Evaluative Sciences that I collaborated with some scientists there, and hopefully it'll sort of alleviate some of the fears that were brought out by the survey that Katie presented. So the aim of this study was to determine vaccine uptake rates, so how often are people with IBD, or children with IBD, vaccinated in Ontario, and what are the adverse events secondary to immunization? So do children with IBD have more rates of adverse events as a result of having IBD or being immunocompromised than patients without IBD? So we were able to use a large database called the Ontario Crohn's and Colitis Cohort, which is a surveillance database of all children with IBD in the province of Ontario, which is tracked through health administrative data. So health administrative data are the large databases like the OHIP billing database, the hospitalization database that the government uses to track the cost of health care. It's made available to researchers to use, and all the patient data is anonymized, so we don't know who it is or anything like that, but we can track, once we've identified that they have IBD, we can track them throughout their lives as long as they have an OHIP card. So the Ontario Crohn's and Colitis Cohort sort of tracks all childhood onset IBD in the province of Ontario. We took all children diagnosed with IBD under the age of 19 between 1999 and 2010, and the reason we chose 1999 was that was the year, or 2000 was the year where Ontario introduced their universal immunization program for influenza. So in 2000, that was the first year, or 1999 was the first year where there was a physician billing code for giving the flu shot. And so we were able to track anybody who got the flu shot at a physician's office or by a nurse practitioner. So there were 5,000 children under 19 who were diagnosed with IBD during that time period, and we compared them to about 21,000 patients without IBD, children without IBD of the same age. We use the administrative databases, so all the adverse events that we're talking about, all the risks that we're talking about, really are about contacts with the healthcare system. So we can track when a patient sees a physician and why. We can track when they're hospitalized and when they visit the emergency department. What we can't tell is, clinical things like how many poops they've had, or are they really flaring, and that's why they saw a physician. All we can tell is that they saw a physician for their IBD or for another reason. So the adverse events that we're talking about are the healthcare system contacts, like outpatient physician visits. So overall, we looked at overall number of visits as well as visits for IBD-related reasons. So not only Crohn's and UC, but also things like abdominal pain, diarrhea, and other diagnoses like that. Emergency department contacts, as well as hospitalization rates. So in terms of what are the immunization rates, we found that in general immunization rates were pretty poor in Ontario, and this isn't a surprise, this has been shown before. On the other hand, children with IBD were more likely to be immunized against the flu in any given year compared to children without IBD. You can see that after the introduction of the universal immunization program, the rates of flu vaccine did jump, but in general it's been pretty stable since then. And the likelihood of why children with IBD are being immunized more often, if you think about it, children with IBD have more access to the healthcare system, they see doctors more, so they're more likely to be immunized by a doctor. It may be that the children without IBD are being immunized in public health clinics by nurses, so they may be immunized at the same rates, but we can't tell that. So all we know is that it looks like they're being immunized a bit more. That being said, the immunization rates are not great. So only about 25% of kids with IBD were ever immunized in their entire follow-up period, so there was about 10 years of follow-up there. And only about 4% were immunized every year that they qualified for immunization. So that's a pretty low rate no matter what. Now, we do know that about half of kids in general get immunized in public health clinics, and so you may be able to double that rate to get the real number, but still it's pretty low. Now, this is the risk of overall adverse events. So risk of contact with the healthcare system for any reason in 2-week periods. So these are each 2-week period after being vaccinated with the flu shot compared to the same patient in time periods when they're not vaccinated. So we took a time period when they were vaccinated and looked at every 2 weeks after that, compared to time periods in the rest of the 10-year follow-up where they weren't vaccinated, and compared the rates of visiting a doctor, being hospitalized, or visiting an emergency department. So this graph shows basically the risk, and if you've got a relative incidence of 1, that means there is no risk in the post-vaccine period compared to times when they're not vaccinated, okay? So if it's 1, it means no risk. If the line crosses that 1 mark, it means there's no statistically significant increase or decrease in the risk, okay? So you can see that for every 2-week period after being immunized, the line crosses 1 at every point, so there's no increased or decreased risk of needing to see a doctor, being hospitalized, or going to an emergency room after being vaccinated. So no increased risk of the vaccine in IBD patients. And these two numbers are the pooled numbers, so the full 6-month period. Again, no increased or decreased risk. In non-IBD patients, we basically saw exactly the same thing. There really wasn't an increased or decreased risk, except for in this first 2 weeks, and that wasn't really a surprise. We know that people, this is called the healthy vaccine recipient effect, that people who get a vaccine are healthier than any other time in their lives when they're getting it. The doctor waits till you're healthy to give you a vaccine. So in the 2 weeks afterwards, you're less likely to need to see a doctor again. So that's sort of more of a statistical anomaly than anything else. But in general, non-IBD patients, same thing, no increased risk of the flu vaccine. So what about IBD-related healthcare visits? So we did the same thing, but we only looked at visits to the doctor for IBD-related reasons, okay? And you can see that in general there's no increased risk, but it seems like it's trending towards a protective effect. So if the number is to the left of the dotted line, to the left of 1, that means you're protected, okay? And if you pool all 6 months, there is a statistically significant protective effect. So it looks like there's about a 20%, 1 minus 0.78, about a 20% protection getting the flu shot. In years that you got the flu shot, you were 20% less likely to need to see a doctor for an IBD-related reason, okay? Now, we're not saying necessarily that, the shot protects you. There's a whole bunch of different reasons why this may be. But in general, it's certainly no increased risk, and there may actually be some protection there. So we concluded that definitely the influenza immunization is safe. We're seeing no evidence that the the flu shot causes a flare-up in disease. It, in fact, might protect against an IBD flare, or at least protects against needing to see a doctor for an IBD-related reason. There's definitely poor uptake of the vaccine in Ontario children with IBD, and I think we need to be doing a better job at promoting the use of the flu shot in IBD patients. And I think it opens the door for a lot of future research that we plan to do. I think the number one question is, does influenza trigger an IBD flare? There's no doubt that, in our experience clinically, that we frequently see and we get the story of everybody in the family being sick, and then everybody got better except the patient who has IBD, who kept getting worse and flared up. So it seems like there's certainly a relationship between infection and potentially viral infection and flare-ups of IBD, but we haven't yet proven that in the lab or in the clinic. The immunization may well protect against a flare, whether it's from protecting against the virus itself or some other mechanism, we're not sure. And what's the best method to improve uptake? And Katie spoke a little bit about that earlier. So in general, sort of the overall conclusions about vaccines is that vaccines are generally an important part of IBD treatment, especially when the children are immunocompromised and at increased risk for getting some of these bugs. The vaccine schedule is definitely complex. It's sort of busy and there's a lot to remember. So it's really a matter of us working together, the patients, the children, and the families, and the healthcare team, in order to make sure that all the immunizations are done on time. And again, the message again that we need to avoid live virus vaccines if your child is immunocompromised, and if they're on azathioprine, methotrexate, infliximab, and adalimumab. The goal is to be immunized before you get these medications, but not always possible, so we just have to watch out for that. Thank you very much.